Hi, everyone. Welcome to PPI's Wellness Wednesday. I'm here today with my colleague, Kaci, and we are so excited that it's a new month. Happy spring, everyone. And this month, we have realized that there are two observances. There's one for High Blood Pressure Awareness Month, and there's also for National Preeclampsia Month. So Kaci and I are going to discuss this. But first, let me take a break to say that my name is Christine Ivery, and I'm the health educator for the Prematurity Prevention Initiative, and I'm here with my colleague, Kaci.
Yes. Hi, everyone. Thanks, Christine. My name is Kaci Mial. I'm also a health educator with the Prematurity Prevention Initiative, and we are here for Wellness Wednesday again. We have lots of guests planned for you this month, so check us out. Continue to tune in every Wednesday, 12 p.m., and we'll be sharing this great information with you.
Absolutely. And Kaci, if anyone missed Wellness Wednesday from our March, our April, and now we're in May, we can always have folks go to @NJ on Instagram. And you can also check us out on Facebook, on Twitter, and also LinkedIn as well.
Yeah, absolutely. And you can check out our older videos as well.
Yes. So thinking about our conversation today, and Kaci, we just discussed this, and the great severity really, or such as hypertension, or also known as high blood pressure. So I want to talk about that one first. So we know that high blood pressure, that is too strong in your arteries or in your veins. We know that that blood pressure can get too high and cause what's known as high blood pressure. Kaci's going to talk about it in a minute, but for pregnancy considerations, sometimes women can have preeclampsia. But one good thing to know about high blood pressure is that it is preventable, and there are things that you can do to treat it. So we're going to talk about that more towards the end of our presentation, about how to achieve that good blood pressure and to stay healthy throughout your time of pregnancy as well.
Absolutely. So preeclampsia is another thing that we want to highlight here because it can be definitely a life-threatening issue. And preeclampsia can show up during pregnancy, even postpartum. So we'll tell you a few of the warning signs for that as well. But just to give a quick definition for it, preeclampsia, it's a complicated issue in pregnancy that can be very dangerous to the person who is currently pregnant and also to baby. So it usually begins after 20 weeks of pregnancy, give or take. And some signs are what Christine was just saying, that high blood pressure, there may be protein in the urine, low blood platelet count, impaired liver function, fluid in the lungs, kidney problems. So fun fact, if you are currently pregnant, you may have already been screened for preeclampsia and, not even known it because what providers are looking for are tests through the urine. Ultrasounds also help them, possibly non-stress tests, taking your blood pressure. So all of those things are usually included in prenatal appointments. So it's kind of cool.
Yes, it's good to know that providers are screening for all these different things that can happen as far as complications related to preeclampsia. And Kaci, for women that just had a baby and they are new moms and they're back home, what are some warning signs or some risk factors that they should look out for?
Absolutely. So warning signs for particularly postpartum preeclampsia, you want to look out for, because you may, I would say during pregnancy, continue to go to your regular prenatal appointments and call your provider if something doesn't feel right. And typically they can pick up on that. But for postpartum, what ends up being really dangerous is moms are sent home after birth and, you're told you have a healthy baby, you're healthy and everything is good to go, right? But then you might notice some symptoms or something changing. If you have a headache or blurred vision, a lot of times we don't think of a headache being this life-threatening thing, right? But after birth, it certainly is, it can be a sign of preeclampsia. Also, if you have a pain in your lower side, you should also get that checked out and either call your provider if it just started, or if it's an emergency, definitely make sure to call.
Yes. So just like Casey said, a headache, a blurred vision that won't go away, all these different things are really some of those red flags to look for when you go home and you're in that postpartum period. So Casey, I wanted to transition to talk about what can women or what can pregnant people do to avoid high blood pressure or to really see those warning signs of preeclampsia before they begin. But one thing is, before pregnancy, just make sure that you have a plan to talk to your doctor or your healthcare team about healthy ways that you can have a healthy weight or ways that you can involve physical activity in your routine. We know that physical activity or movement is really, really good to help to prevent preeclampsia or to prevent hypertension or high blood pressure. And then
Absolutely.
yeah, and then during your pregnancy, doing the same thing, making sure that you are having that open conversation with your doctor. If you're taking any type of medication or if you need to take any type of medication, make sure that you talk to your provider first to check in to see if that is something that you should take, because sometimes that can be a boundary with this.
Mhm.
And then lastly, thinking about after pregnancy, just as Casey mentioned with those pay attention to signs, we want to pay attention to those telltale signs that will tell you if you are experiencing any type of preeclampsia type of activity. And also if you have a blood pressure cuff at home, there's nothing wrong with a couple of monitors every once in a while or maybe once a week to see what your blood pressure is looking like. So those are some tips of what you can do.
Yeah, and if you're a provider tuning in on our website, njpreterm.org, we do have those Go kits that have free blood pressure cuffs within them. If you want to request that, let us know. We have they are free kits, and you would just have to fill out an application, and we can send you more information about that.
Yes, we have those free Go kits. And then also, Casey, we have those pay attention to cards. So if you're
Oh,
a
yes.
mom and you'd like a magnet that has all these signs on them, you could reach out to us and we could provide a handout or a printout so that you can see those signs on a piece of paper or put them on your refrigerator, just so you know that you can identify if these things are happening, that you should call your provider or 911.
Absolutely. And Christine, the other thing this makes me think about, so we are Prematurity Prevention Initiative, right? So we always, if you all have heard me and Christine before, we always bring it back to preterm birth somehow. And so we wanted to let you know also, what is the link here? Why are we talking about high blood pressure? Why are we talking about preeclampsia? Of course, these are super important topics on their own. But they also relate to preterm birth. And if you have preeclampsia, it can lead to preterm birth in some cases. One thing we always say is sometimes you can do everything right, quote unquote, right? You can do that exercise, you can eat nutritious foods and have low stress. And sometimes these things still just happen. We can do what we can to prevent, but with preeclampsia, it can lead to preterm birth because it can reduce blood flow to the placenta. So that's where baby's growing. It can contribute to baby being born low birth weight or born early. So that's why it's also important here at PPI for us to talk about as well.
Yes. In case you mentioned that as we're thinking about preterm birth and how to prevent it, I know that we mentioned 17P, and it's a really great time to talk about that as well. So 17P is a drug that women can take during pregnancy that can help to prevent a preterm birth or to prevent a preterm birth if you have had a previous preterm birth, or if your doctor deems that you're at risk, you can use this particular medicine. And the good thing is that 17P has funding for 17P. And so we can provide that medicine if your insurance does not cover it. And then also we have a home visiting program as well that we can share so that if you need to get this medication on a weekly basis, which you will if you have 17P, we have nurse home visitors that can come to your house safely during this time of the pandemic and distribute that injection for you on a weekly basis.
I just think those things are so awesome that we have that available. And, a lot of times people are like, what is 17P? No one told me about that.
Yeah.
So definitely check out the rest of our social media and our website to learn more. If you have had a previous preterm birth, check it out, or let me and Christine know. We're here to answer questions. And lastly, with that, if you are somebody currently on 17P, we have our virtual texting tool. So that is really cool. If you text baby NJ to 52046, you will receive messages, and you can sign up for our texting program. You can receive messages about hope and joy and fun stuff like that. But you can also get links to different information about not only 17P, but just healthy pregnancy in general. So that's also on our social media if you want to check out that flyer and sign up.
Yes, Kaci, just as I always like to tie in, we have so much going on with PPI, but we like to make sure that we are offering it to everyone who may need it. And with that, I think that's all for today. But if you do want to reach out about any of the resources that Kaci and I shared, like she mentioned, you can reach out to us on social media at NJ Preterm. And you can also reach out to us on our website at njpreterm.org.
Thank you, everyone.
Thank you.